longstanding challenge in healthcare is the lack of behavioral and social support services that bolster the efforts of doctors to keep us well and treat illness. Diane Burns with Florida Hospital's Center for Aging and Wellness is joining me to discuss how some physicians' offices are creating interdisciplinary healthcare teams to help address that need. And Diane, speaking of that, what a need that is important to so many seniors, having somebody, having an advocate, having a social worker to assist them during a doctor's visit.
It really is, Carol. Not only during the visit, but between visits. And I do a lot of interaction with patients and families by phone between visits. That's part of the job.
To just make them have that connection, because I know, and especially for seniors, so many times we have not just one doctor, but we have multiple doctor visits.
Yes.
And that can really be confusing. So how do you come in to kind of, I don't want to say take charge, but to organize that whole situation?
Well, I like to think of my job as being surrounding 4 C's. Connecting, counseling, coordinating, and communication. So I'm helping with patients and families connect with community resources that they might not know are available for support. And then I am counseling with patients and families about care options, and also sometimes around the process of disease and what to expect, how to manage and handle things. I'm helping to coordinate care, sometimes like you said, between several different practitioners that might be involved. Also with the outside providers such as home health care agencies, durable medical equipment providers, all of those elements that help keep people supported between doctors' visits and help keep them out of hospitals as well. And then communication is a big part of it, just being able to help the patient, the caregiver, communicate with the doctors, sometimes with their health insurers, and sometimes with those outside providers. All of that is a piece of the puzzle.
Oh, certainly. And I imagine this is really an option that a caregiver, a spouse, a son or daughter can certainly take advantage of.
Yeah, that's a huge part of it. I think that pediatrics and geriatrics are the 2 areas of medical providing that involve the family the most. And I don't want to say that all of our older adult patients have family involvement. Some are very, very independent. Our doctors treat well older adults as well as those with complex needs. But as needs increase in older age, then obviously a lot of times family caregivers are very involved.
Yeah, that's what I would imagine. You're helping to not only educate the patient themselves, but their circle of support as well.
And a circle of support is a great, I think, way to express it. Because as we age, all of us need multiple sources of support. And the folks who are have more complex conditions or multiple comorbidities, and then especially those who may have a dementia process going on, they need not only the physician and the caregiver on their side, they also need multiple sources of support. The caregivers need support. I do facilitate a caregiver support group at our location.
Great.
It's connected with the Alzheimer's Association as well.
And obviously we're going to have all of that information available for our viewers. But Diane, thank you so much for all of this information. Thank you for stopping in with the primary care settings. They're so fast-paced and confusing. It's nice to hear that many medical practices are hiring social workers to assist their patients in providing personal-centered care. Thanks again.
Thanks very much.